life is like a box of chocolates. You never know what you're gonna get. It's one of the most famous quotes from the movie Forrest Gump. It means that life is changeable and unpredictable. Similarly, bone tumors could be very unpredictable. The principles of management of bone tumors is not so well known by many of the physicians, but misdiagnosis and improper management could lead to catastrophic outcomes. This is Dr. Chen Yu from the orthopedic department from the First Hospital of China Medical University. In this clip, I'm going to make a very brief introduction about fundamentals and the principles of treatment about bone tumors. I would like to start with several photographs. These photos demonstrate a very interesting the fifth metatarsal bone of an early ancestor of our human beings. It could be dated back to 1.8 million years ago. What is so special is the hemispherical bony mass located on the proximal ventral aspect of the shaft. Many researchers believe it could be the earliest identifiable case of malignant neoplastic disease, possibly osteosarcoma. That means bone tumors could be a very ancient disease. Conversely, our understanding about this disease is far from enough. This lecture is going to be presented in 4 sections, including the introduction of bone tumors, general approach to bone tumors, biopsy staging, and principles of treatment. The definition of bone tumors is quite simple. Any neoplasms that originate from the bone could be a bone tumor. In terms of its origin, it could be subdivided into primary and secondary. And in terms of aggressiveness, you could categorize them as benign and malignant. Bone tumors are rare. They account for some small fraction of total tumors. However, the management is very complex. The treatment of bone tumors usually require multiple disciplinary team, including orthopedic surgeons and medical oncologists, radiation oncologists, pathologists, sometimes even with the help from the surgical specialists such as vascular surgeons. There are several ways to evaluate bone tumors, but the most important and the first steps should always be history and physical examination. Age is very important diagnostic information because many types of tumors may occur in some specific age groups. The patients may present to an orthopedic surgeon with some common symptoms including pain, swelling, limb dysfunction, and sometimes just with abnormal radiographic findings during evaluation of an unrelated problem. Imaging studies are very powerful tools to further evaluate bone tumors. Usually we order 4 main types of imaging studies for suspected bone tumors, including plain radiographs, computed tomography in short CT, magnetic resonance images, abbreviated as MRI, and scintigraphy, which is also known as bone scan. Well, plain radiographs can provide very helpful diagnostic information. All of the suspected bone neoplasms should be evaluated in the first place by planar radiographs. The pivotal information obtained include the site of the tumor and aggressiveness. The aggressiveness of the tumor should be carefully evaluated. There are several very important factors that should be taken into account, including the margin of the lesion, the cortical destruction, and some characteristic periosteoreactive bone formation, including Codman's triangle, onion skinning, sunburst appearances, and also the internal composition of the tumor should be carefully evaluated. For example, the irregular trabeculae in the collagenous stroma could be a very characteristic ground glass appearance in the plain radiographs. This is very common in fibrous dysplasia. CT is very helpful in assessing ossification, calcification, and integrity of the cortical bone. The pulmonary CT is the most efficient tool in detecting the metastases in the lungs. MRI is a valuable tool to detect the size, the extent, and anatomical relationship of the bone neoplasms. It's also very efficient to evaluate the soft tissue extension of bone tumors. Bone scan utilizes the technetium-99, which is a type of radioisotope, to detect the osteoblastic activity of a bone lesion. It's very useful to detect multiple bone lesions, but it could be falsely negative in multiple myeloma and renal cell carcinoma. Laboratory tests may not be able to come to the final diagnosis, but in most cases, they are very helpful in facilitation of the determination of the final diagnosis. Commonly used laboratory tests include complete blood cell count, urethral sedimentation rate, and serum protein electrophoresis. A specimen is crucial for the determination of the pathological diagnosis. There are three major types of biopsy we carry out in clinical practice for suspected bone lesions, including the fine needle aspiration, which could provide the cytologic information of the tumor, and core needle biopsy, which uses a larger gauge needle that preserves the tissue architecture so that it would be easier to come to the final pathological diagnosis. And incisional biopsy, this is the gold standard for acquiring the specimen from the bone lesion, but it could be related to some complications. Anakin staging system is frequently used for evaluation of both benign and malignant bone tumors. For benign lesions, the stages include three. They are designated as Arabic numbers, and for the malignant lesions, they are designated as Roman numerals. Surgery is the mainstay treatment for bone tumors. The most important part for surgery is the determination of the resection margin. There are four major types of margin we frequently use, including the intralesional margin, the marginal margin, and wide margin, and radical margins. After resection of the bone tumor, it may result in very wide bone defects, so that reconstructive procedures are needed. The most frequently used methods for reconstruction include osteoarticular allografts and prosthetic reconstruction allograft prosthesis composite and devitalized tumor-bearing autograft reconstruction. The endoprostheses are the most frequently used method for reconstruction in clinical practice. They are very efficient in providing instant stability and allow for rapid rehabilitation, but they are related to some long-term complications, including infection, bone resorption, and loosening of the endoprosthesis. In addition to surgery, we use various types of adjuvant treatment to further improve the survival of the patients with malignant bone tumors. Before the advances of multi-agent chemo, the long-term survival of the patients with bone malignancy is very great. But now, about 50 to 70% of these patients may survive a long-term follow-up. In addition to chemo, we use radiation therapy, molecularly targeted therapy, and immunotherapy to improve the prognosis of various types of disease. Although we have achieved lots of improvements in terms of diagnosis and treatment for bone lesions, there are still many aspects that remains to be investigated. For example, patients representing recurrences and with very poor response to chemotherapy will face a very grim prognosis. In the fight against the bone lesions, we have achieved some improvements, but there is still a long way to go. Thanks very much for your attention.